Quebecers are not all equal when the time comes to obtain a medical assessment to homologate a protection mandate, previously called an incapacity mandate. The assessment is free when performed by a specialist physician, but not when performed by a family physician. General practitioners denounce this inequity between patients. This medical assessment service is covered by the Régie de l'assurance maladie du Québec, RAMQ, when it is performed by medical specialists. The price for this act is $633 in the case of tutorship, curatorship or homologation of a mandate, according to the Ministry of Health and Social Services, MSSS. The situation is quite different for family physicians. The latter receive remuneration of $483.75 for a medical evaluation relating to a tutorship or curatorship. The remuneration is however zero in the event of homologation of a protection mandate. This service is not remunerated in the MSSS FMOQ agreement. Fédération des médecins omnipraticiens du Québec recognizes the MSSS in an email. The Dr Léo Jean Perrin, a family doctor who works in an office and in a geriatric unit in Montreal, deplores this problem of inequity. If the patient has a specialist who follows him, probably he will agree to do it and it will cost the family nothing, he explains. But if it is a general practitioner who follows the patient, it will be billed. The Fédération des médecins omnipraticiens du Québec, FMOQ, suggests that its members charge $480 for the medical evaluation intended for the homologation of a mandate. Recently between colleagues, we talked about this, and we made the decision that we were no longer going to the hospital to fill out these documents, says Dr. Léo Jean Perrin. We were no longer comfortable exchanging money with families. The Dr. Vincent Demers, a family doctor who treats the elderly and patients at home in particular, finds it a little absurd that the medical assessment is covered by the RAMQ during curatorship or tutorship, but not in the framework of the homologation of a protection mandate. The work is the same, he recalls. The general practitioner is sorry that the far-sighted patients who have prepared an incapacity mandate are a little penalized. So far, I've never billed patients for it, says Dr. Vincent Demers. However, the doctor believes that he will have to do it in the future, the procedure being very cumbersome. You can imagine, determining if someone is fit to manage their property or their person is something very complex and time-consuming, he says. It is for the protection of the patient at the end of the line. Quote,